Welcome back, everyone, to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here at day 4 of Singularity University's Exponential Medicine. I hope that you can help me welcome a very special guest to the Insights Lounge, Dr. Tony Young. Tony, welcome to the interview.
Thanks very much for having me here.
Tony has a very special role. He is the National Clinical Director of Innovation for NHS England. Tony, we were chatting before the interview started. I know that you have been to several exponential medicines. What have you gotten from this particular experience?
I think one of the great things you get when you come to the United States is an injection of can-do enthusiasm, because anything is possible. You just need to hear some of the keynotes that we've had this week, and it's astounding. What ones of those will come into reality, we'll see with time, but this is my third exponential medicine here in San Diego, and I think the first year I was here, there was lots of technology around the new wearables that were coming out, and it seemed to be all about that. And then the second year, we were moving more to the platforms and the integration of those wearables. But this year, I think the theme more of prevention and getting upstream in how do we change and rebuild our healthcare system so that it's fit for the challenges we now face, which are around chronic disease management, which is such a large burden of the healthcare we face looking in the future.
Absolutely, and I think that today's main stage, you're going to hear several more speakers really kind of address what is that definition of wellness. We had Pripal Tamber on yesterday, and I think that he's going to have probably a very provocative conversation, so I'm looking forward to having you hear that as well. So Tony, you are a self-described mad inventor. Can you tell us a bit about your philosophy on the role technology and new medical devices have in reshaping the future of health?
So I think the advances in technology we've seen over recent years are quite astounding. Some of the things we've seen here, if you look at HeartFlow coming out of Stanford, it's transformative. It's a disruptive thing which is going to displace the way we do things. But in many of the technologies we see, introduced on their own, they're not the solution or the answer, and it has to be part of a broader care pathway. And if we bring in, and I think it's come out again in several of the talks we've heard here, if we bring technology in, but we don't consider how we socially include the patients and our population with that. So you end up giving them some technology, but they end up more socially isolated as a result of that, then the technology tends not to be taken up. So how can we bring technology in that increases social network, increases social inclusion, makes people feel more part of our society? And I think that's the real key to driving change. It's why everyone carries a smartphone in their pocket. They're connected, aren't they? It increases your networks. How can we do that with aspects of technology? We've seen lots of things from virtual nurses and other platforms. So how can we connect people with it? And I think that's the key thing. If you can increase social inclusion with using new and advanced technology as part of a whole system care pathway. So I think the days are gone of where you used to be able to say, I've got this great new medical device, wouldn't you like to buy it? Right. I think what you have to come along now and say is, I've got this great new medical device, it's going to impact healthcare across this space, this is how it fits in there, and we're prepared to be with you the whole journey along that pathway.
And I'm sure that in your role, Tony, that you're helping to ensure that the folks that are working with NHS are really including that patient voice from the beginning stages. Is there a particular method or process that you espouse in ensuring that the patient's voice is really present from the very beginning?
So, there's a couple of things. I think there's almost a change in the paradigm that the patient voice is absolutely very important, but actually perhaps we need to move to slightly more of the human voice, because patients are already sick. Right. And actually if we're going to be really disruptive in innovation, when Clayton Christensen described and coined the term disruptive innovation, it was about creating new markets. And isn't the new market in healthcare people who are well, and how can we, so they're not patients, they're not sick yet, how can we encourage them to get well? How can we become serious about prevention? There are so many issues we face in England. The shocking figures at the moment are almost 2/3 of our population now are either overweight or obese. So our nation is sort of piling on the pounds on its waistline, and we're piling on billions of pounds in future taxes for our economy for an entirely preventable disease. It's one of the most important issues we face. So we have to get upstream, we have to prevent these things occurring in the first place. But if we don't include our patients, if we don't include our citizens who are well in the process, so they're helping us design it. I think the days are gone where it's just doctors on their own who can stand there and say what's best for people. We need the doctors, we need the nurses, we need the allied health practitioners, the physicians' associates, the social workers, we need the patients, their relatives, and citizens out there to come and say, how can we redesign and reimagine healthcare together? So absolutely, patients are right at the heart of what we do, right. But we mustn't leave out our workforce and all the other citizens. We have to do it together.
Right, right. So Tony, you speak to a major theme that's been so prevalent here in exponential medicine, and that's the democratization of health, where it is so much more collaborative. So you certainly speak to that. Let me tee up your next question for you. From your perspective, what's the next big thing in medical devices?
Wow. I mean, I'm in a very fortunate position because the world tends to beat its way to the door of the NHS. We're the largest and longest established healthcare system in the history of our planet, and therefore people want to come and tell us about the latest, greatest things that are going on. So you've given me a really tough challenge. There are so many. To pick one, I think it's so difficult. I think the themes that are emerging around the omics and all the various things that are going on there, I think that is as whole genome sequencing and screening come on, and we saw it in the presentation yesterday from the longevity team on what they're doing, and increasingly things like that are going to come to the fore. But then if you look at advanced technology and how we're taking things on, the miniaturization, robots, so many other things may have a role to play, but again, in isolation, not so much. Some very simple things can also be done in technology. In the United Kingdom, we have an obstetrician who's just invented something really simple. It's a pair of scissors that's just sort of angled at the top, and it guides you how to make an episiotomy. So in labor, when the perineum may be about to tear, it guides you to exactly the right angle cut you should make. And the early data from that shows we have more than halved obstetric anal sphincter injury tears, which is a devastating thing for a young mum to have damage to that area. And so a simple thing, like some angled scissors that allow you to measure it. So it could be very simple. It could be a piece of software. I mean, I'm always, whenever I hear the HeartFlow team from Stanford present, it is disruptive and amazing what that sort of thing could do. But the key thing, I think, is whether it's advanced technology, whether it's data analytics, whether it's the deep learning we've heard so much about, all these things coming together. I don't think you can pick one, but I think all taken together, what we are, I think, in the next 5 or 10 years looking at is, so 250 years ago we had an industrial revolution, and our processes went from handmade to a manufacturing process in factories, and I think we're looking at the same sort of thing now in a healthcare revolution driven by the personalized medicine and precision medicine agenda. And I think technology is advancing at such a stage and coming together now that we're not going to recognize healthcare in around 10 years' time. And the sort of things we do now, which are, they're very labor intensive, and we need to sort those. So it's not one technology. I think they're all going to start coming together to deliver this healthcare revolution.
So Tony, what you just addressed, I think that you would agree that we've asked many of our guests here at the Insights Lounge whether we're in the midst of a healthcare renaissance. I think that you would agree we certainly are.
And I think it's, you can see it's a number of steps on the way have led to it. So the internet coming forward, smartphones coming forward, the digital health platforms and data analytics and all those things. It's such an exciting time to be around with all these changes happening. I used to look back with some envy in a way at history when anesthetics were discovered and x-rays were discovered, and all these great advances were made 150 years ago. And where were the new frontiers? And lots of operations, well, we've been doing them for 100 years. There aren't very many new ones. We do things in a slightly different way. But actually, all this convergence of the omics, the technology, is coming together, and it's a new frontier, and it's really exciting. And I absolutely agree we're on the verge over the next 5 to 10 years of a completely new way of delivering healthcare.
So Tony, you referenced such a remarkable history for NHS. Being the longest standing health service program in the world, that's quite a legacy. So given that, in your role as National Clinical Director of Innovation at NHS, How do you instill disruptive breakthrough innovation that has a real impact in such a large entrenched health system?
Okay, so it's not an easy thing to do, and there's no one easy answer to that. But a year ago, the NHS published its vision for the future, a 5-year forward view, looking at the sort of grand challenges we face. We've heard about many of those here, how we have to get serious about prevention, how we have to reimagine and rebuild from the ground up our care pathways, but how we have to offer a higher quality at a lower cost, because we can't keep piling more and more cost on our healthcare systems. So given those grand challenges, we've put a number of sort of building blocks in place. So I suppose if I was to give an answer to your question in one word, it would be culture. The culture of an organization and how you conduct that, how you work with your staff. I mean, the NHS has 1.4 million staff. I think it's the 5th largest employer on the planet. And our workforce are our most valuable asset. So if we put a number of building blocks in place that encourage our workforce to help us transform, work with our patients, work with our citizens to transform healthcare, then we've got a chance at disrupting innovation. So a number of programs we have, a testbed program that's just going out where we're taking 6 or 7 areas of our country with populations of 1 million people, and we're trialing and testing innovations at scale right across those populations. We've launched a year ago a national innovation accelerator, so you can see lots of tech accelerators. Well, we went to the world and we said, what are the latest, greatest inventions, innovations, ideas that you have? And I think we shortlisted and are running through 16 fellows in our first year, from the Alive core, mobile phone attachments and platform, to some very simple things around coaching and mentoring for healthcare operatives. It's so interesting that at medical school you get taught how to make patients better, but we don't get taught how to teach patients to look after themselves, to be informed about their conditions. So one of our fellows is a coaching or mentoring scheme for clinical staff to tell them how can you best educate your patients and take it forward. So there are a whole series of things we're putting in place. One thing I was able to speak about here, which has just had a press release this week actually, is our clinical entrepreneur training program. So we are the first nation on the planet to launch a nationwide clinical entrepreneur training program. And what that means, in year 1, all doctors in training in our country, of which there are around 55,000, can apply to do part-time training in clinical practice, and then have part of their time in their week to undertake entrepreneurial activity. And no one has ever done it at this scale before across the country, because I think the skills that an entrepreneur has, and they can bring the knowledge, their understanding, if we are going to grasp the potential of the new technologies that are coming forward, whether it's from deep learning, they don't teach you about deep learning at medical school, so we have to work with industry, we have to work with the startups, the entrepreneurs, the investors, the organizations like Singularity University to take these things forward. So the program went live. We have applications going at the moment. I hope I don't get 55,000 applications. I won't quite know how to deal with that. But in year 1, it's doctors. In year 2, it's nurses, allied health practitioners, clinical scientists, pharmacists, physicians associates. Because why is it that doctors have all the answers? It's not. It's our whole healthcare workforce. But in year 3, our ambition is to expand that into patients and citizens, because why is it the medical profession assumes we have all the answers? There are some amazing insights and understandings you can gain from people who've actually had the problems on the front line, and they need to be included from the word go. So those, in answer to your question, it's a series of building blocks that we're putting in place to encourage our workforce and our patients and our citizens to come with us on an innovation journey and rebuild our healthcare system.
Well, Tony Young, I'm simply overwhelmed with the scope and the scale and the passion that you bring to your position, and I think that the UK is enormously lucky to have you in the role that you play. So thank you so much for sharing all of your insights here with us at the Guidewell Insights Lounge. I absolutely hope to see you next year here. We have to get a report out on all the successes that you're bringing to market.
I look forward to coming back and telling you all about it.
Thank you so much. My name is Kate Warnock. I think we're getting ready to go back to main stage. Please join us again soon.